Greeting friends, today we will talking about a stroke is the kind of disease that affects a person at once, and most people are unaware of their body's symptoms and warnings. After having a stroke, they realize what a big problem they have and what complications and disabilities they have to endure. That is why stroke is the second leading cause of death in the world. A stroke is a type of brain attack that occurs following a blockage of blood flow to the brain. If you ask a person who has suffered a stroke, what symptoms did you have when the stroke occurred and what caused you to suffer from this condition? They generally do not give you a clear answer. Because the stroke causes such a shock to these people that they have no knowledge of the time of the stroke because everything happens in less than a few minutes. But it should also be pointed out that a stroke does not happen without any reason and without symptoms. It cannot be said that a person has this condition all of a sudden. The person's body definitely starts to give warnings and symptoms such as numbness before suffering a stroke. Weakness in the body, high blood pressure, etc. Knowing the necessary information about the signs and symptoms of stroke is important for all people. Because we are all susceptible to such a complication, a question that we should concern is: what are the signs of the body before a stroke? A stroke occurs when the blood supply to parts of the brain is disrupted, so if the brain does not receive enough blood, the body cannot perform its tasks properly. The functioning of the brain has a great impact on the actions of the body. When a blood vessel is blocked or torn, not enough blood reaches the brain, and this causes the brain to be unable to send correct commands to the body's organs. And this is also the main cause of stroke symptoms. Therefore, a stroke occurs with warnings such as suffering from severe and sudden headache, temporary feeling of dizziness and confusion, disturbance in communicating with others, disturbance in vision and blurred vision, numbness and severe weakness in the arms and hands, releasing objects from the hands due to numbness. These symptoms you observed, there are symptoms that occur when a stroke occurs and appear quickly. Therefore, everyone wants to know about their disease before they develop symptoms. Definitely a person who has had a stroke before the symptoms mentioned above become infected, the body shows a series of reactions that include high blood pressure. High blood pressure is the big, silent alarm that is considered the leading cause of stroke because high blood pressure causes severe damage to blood vessels. Occurrence of blood clots in the brain, rupture of blood vessels in the brain, and disturbances in the blood supply process are among the problems that appear after high blood pressure. Visual disorders. During the research conducted on all the people who have suffered a stroke, most of them had vision problems several hours before having a stroke. The reason for such a warning is reported to be the blockage or rupture of a blood vessel in the brain before a stroke. Sudden migraine. Basically, migraine attacks do not happen all at once and causes such as light and sound, stimulating foods, etc. are involved in its occurrence. If you don't have a history of migraine attacks and you suddenly get throbbing and one-sided headaches, know that the blood flow in the brain has been disrupted and the disruption or blockage of blood flow to the brain is equal to a stroke. Severe stiffness in the neck and shoulders. If all of a sudden, without any particular reason, you are suffering from extreme stiffness and dryness, know that something strange is happening in your brain. One of these events is the rupture of blood vessels in the brain, which caused such symptoms. High blood pressure is the body's most important warning before having a stroke. Unfortunately, high blood pressure is a chronic and asymptomatic disease that many people with high blood pressure are not aware of their disease. After cardiovascular diseases, stroke is the most important disorder that occurs after high blood pressure. Blood pressure is the pressure exerted by the blood on the walls of the blood vessels while vessels. The normal value of blood pressure is less than 120 millimeters. If a person's blood pressure is lower or higher than this value, he is suffering from low or high blood pressure. High and low pressure is dangerous. Low blood pressure increases the risk of losing consciousness, and high blood pressure causes various brain and heart diseases. Of course, if the blood pressure is higher than normal, in this case, more pressure is applied to the veins, and this factor causes the veins to be torn and damaged. One of the most dangerous areas where blood pressure threatens the veins, cerebral vessels. High blood pressure weakens the blood vessels in the brain and prevents proper blood flow, so high blood pressure is directly related to the risk of stroke. What should we do when we see the symptoms of a stroke? Due to the fact that the most important way to treat a stroke is to detect the symptoms in time, and it is possible to recover from a stroke in the first 4 to 5 hours of the onset of symptoms. In stroke complications, every second is important and the smallest symptoms of stroke should not be neglected. Loss of time in a stroke is equal to death or having complications such as speech disorder, when walking, tilting of one face. That's why when from the side that suffers from brain disability, it can affect the mouth and aphasia, and ask why you have such a disease. They say, complications of stroke generally begin with ischemic operation or temporary stroke, and its severity increases with the passage of time. However, in cases where the symptoms and warnings of stroke are observed, it is suggested to call the emergency room as soon as possible. But you should be careful to use the implementation of such actions. Remove any factors that cause the patient to have problems, and for the best, loosen the person's clothes and avoid giving the person food and drink. If the patient is not unconscious and is standing, help him lie down and place the patient's head in a suitable position. It worsens the patient's condition. Check vital signs such as pulse and eyesight before arriving at the emergency room. Carefully explain the symptoms found for the patient to the emergency doctor and to the neurologist in the hospital. What people are at risk for stroke? With busy lives and increased stress among people in society, everyone is at risk for stroke. But in some people, it is more like obesity, high blood pressure, being a smoker, looking at life and cholesterol in such a mystical way. Basically, it is expected that stroke is more common in the elderly, but this reason has increased the risk of stroke in young people due to the use of tobacco, especially cigarettes, and the use of fatty and ready-to-eat foods. The main cause of stroke in the elderly is generally due to blood diseases and high blood pressure. If we ignore the high blood pressure in the elderly, basically with increasing age, they become weak and lose their resistance, hence they become vulnerable to all kinds of diseases. Lack of exercise and lack of stimulation are effective factors that directly affect obesity, high blood pressure, diabetes, and high cholesterol. Therefore, it can be said that it is one of the most effective factors in stroke. It may be interesting to you, but people who live in big cities and constantly deal with air pollution are more likely to have a stroke than other people. We hope this information help you and your dear one. For more educational videos, please like and subscribe us. Remember that the health is #1 priority.